Hello, everyone. This is David Vetti. I'm going to go over the Texas focused on coverage, healthcare coverage, and rural hospital crisis. Uh, the nation's highest uninsured rate, and did not expand Medicaid, rely heavily on ACA marketplace. And they're talking about doing away with that, as per Pillsbury, Winthrop, Shaw, and Pittman. The government shut down appropriation statements. Yeah, okay. So that's as per this, and the pros that we're going to have is rural healthcare transformation program. Texas has appropriated $50 million for rural hospitals, rural health transformation program. Proponents hope this can stabilize care in vulnerable areas, and that's from Kera News, KERA. That's a local news station. Con is the healthcare coverage loss. Up to 1.7 million Texans are expected to lose their healthcare insurance due to the expiration of enhanced tax credits and changes in the recent GOP tax spending bill, which includes new enrollment, bureaucracy for some premiums could triple. Source Texas Tribune. Uh, the news has been focusing mainly on Texas news, highlighting a looming healthcare crisis. The state's already strained system faces a spike in the uninsured rate. Rural hospitals leaders warned that this could, without direct financial stabilization, this could end a lot of the hospitals and could cost more of the state's rural hospitals, 70% of which have already lost services. So 70% have already lost services. It's going to lose more. And that's what we need to really be paying attention to with this ACA cuts, that the Republicans are saying that the Democrats are trying to give to undocumented people, but the actual plan does not allow for that. There's nowhere in the federal guidelines that allows for undocumented to get Medicare, Medicaid, or any of that from the federal government, unless involved in EMTALA, which is emergency procedures. They've also got stipulations for under 18 minors can have coverage to a degree, and also pregnant mothers would be covered to a degree under the federal plan. Some states have actually gone so far as to set up programs so that they can have these people covered. And what this is not really paying for the undocumented health care. It is, but it's not. By paying for that, they're cutting back on the hospitals trying to raise their prices because they're not getting their money in. Further in bipartisan reform ideas, this is national groups proposed bipartisan reform that could focus on stabilization in the individual's market, reinsuring programs, auto enrollment for subsidized eligible people. In other words, if you need subsidization, they can get it for you, and that's what they're trying to enact in this agreement. But the Republicans are saying, well, you've heard the Speaker of the House, Mike Johnson, say, we're not going to go into session. This is going to be the longest one ever until they concede the ACA. So that's part of the reason, but the real reason is something else. It involves the e-files, and you know what I'm talking about there. Texas specific challenges. Texas high uninsured rate makes it uniquely susceptible to national policy changes. Local providers on the border and community health centers worry about services being impacted by federal cuts and the increasing rate of uninsured patients. Sources Texas Tribune and KERA News. The policy impact, the expected coverage loss presents the biggest potential spike in Texas's uninsured population since the ACA passed. This increases the strain on remaining hospitals and healthcare providers. That's a given. If you cut it off the insurance, then they don't have the insurance to pay, which doesn't allow them to hire more people in the factory and the hospitals and stuff. So yeah, it's going to snowball. And it's going to end up costing more than it's worth. As far as I just wanted to do this as fun. Executive branch accountability, the lie count, and the use of power. Independent fact checkers track the accuracy of statements made by President and executive branch. Verifiable lie fact checkers at the Washington Post documented 30,573 false or misleading claims during President Donald Trump's first presidential term, an average of 21 a day. This consistency of falsehoods is described as unprecedented in American politics. Sources Wikipedia, which uses other sources, and also the Fact Checker, which has a video on YouTube if you want to go check that out. The executive branch actions, the administration has been actively working on to limit media access.
We were confronted with the problem that Donald Trump says things constantly that are false and misleading.
So we decided to start a database on the Washington Post website cataloging all of President Trump's false or misleading claims.
And we're still paying for the consequence of that ambition.
It was supposed to just be for 100 days.
But after the first 100 days, readers kind of begged us to keep going. So we said we'd do it for another year. And then they begged us to keep going for the rest of his presidency. President Trump has crossed 10,000 false and misleading claims.
So many claims. Normally, reaching 10,000 of anything is good.
My goodness, $10,000. 10,000.
But here, it's just big, like really big. Like the state of Maryland is almost 10,000 square miles big, like 100 times 100 big. So how did we get here?
We review every speech,
every tweet, statement,
White House events, cabinet meetings, campaign rallies.
Really everything he says.
We list all possible factual claims that he has made.
And then we evaluate them, and if they're false or misleading, we add them to our database.
Of course, every president says things that are false or misleading.
Most modern presidents have one big false or misleading claim that is inextricably linked to their time in office.
Well, now you're going to hear the facts from a White House source, and you know my name.
Some are more memorable than others.
I did not have sexual relations with that woman.
That the Iraqi regime continues to possess and conceal some of the most lethal weapons ever devised.
They'll see that if Americans like their doctor, they will keep their doctor. And if you like your insurance plan, you will keep it.
I've already started building the wall. We built large sections.
But President Trump doesn't just have one. He has nearly 300 claims that he's repeated 3 or more times since taking office. And some of those claims he's repeated literally hundreds of times. Here are the top 3.
So we're building the wall. It started. And we started the wall. It's doing well. Including the building of the wall, which we started, but we should build it at one time.
President Trump's wall is not being built.
The funding that Congress has approved is for repairs and fencing.
Power of the purse isn't agreeing to it. You can't do it. That's the way the federal government works.
You have to see these trade deals.
We were losing a fortune.
Hundreds of billions. We lost $500 billion.
300, 400, 500 billion dollars a year.
Billion! And for years, we were losing a tremendous amount of money.
We're losing a lot of money.
That's false.
It's just a false construct.
Countries don't make or lose money on trade. It's not like a pickpocketing situation.
It's the biggest reduction in taxes in the history of this country. It's the biggest tax cut in American history.
This is the largest tax cut
in the history of our country. The biggest tax cut biggest reform of all time.
That's false.
Trump doesn't even get past what Obama did.
Trump's tax cut is the 8th largest in the last 100 years.
But the claims don't happen in a vacuum. There are trends. Trump made nearly 3 times as many false or misleading claims in his second year than he did in his first. Almost a quarter of these claims were during campaign-style rallies, and nearly a fifth were about immigration. And what Trump talks about fluctuates based on what's happening in the news.
We're doing this in part for the historical record. It is such an unusual situation when you have a president who is constantly saying so many things that are false and misleading.
He's sui generis. He's of his own kind.
But that's what makes it history.
Oh, believe me, if it's off by 1/100%, it's like I end up getting Pinocchios, right?
Because, they say, I'd like to give him a Pinocchio, 4 Pinocchios.
So if there are things that you're curious about or statements that you've heard you want to know if they're right or wrong, check out the link in our description.
That was President Trump has made over more than 10,000 false or misleading claims, or misleading claims. Yeah. The fact checker, Washington Post, and that's one of the videos. If you want to go check it out, I will include the link in the description. And lastly, ideas for action. What you can do is contact your representatives, urge for your congressional representatives to negotiate a clean, continuing resolution that reopens government immediately while continuing talks on the expiring ACA subsidies in Texas. Contact your state leaders to advocate for direct financial stabilization for rural hospitals. That's policy circle. Another thing is verify information. Always seek out peer review, factual, verified sources when consuming news. Support independent, nonpartisan fact-checking organizations to counteract the illusionary truth effect. The tendency to believe false information after repeated exposures, saying it over and over again, it will gain traction and it will become true. Repeat it until people believe it. Prepare for open enrollment. If you or someone you know receives coverage through the ACA marketplace, be aware of the potential premium spikes and upcoming open enrollment starting November 1st. Check plans and eligibility carefully. This is again sourced through Policy Circle. But yeah, check your health insurances and see what you have and what you can have, and check with your employers if they offer it. Check with your state and local, see what they have to offer. If you're on low income, see if you qualify for Medicare, Medicaid, over 65. One of the plans I have produced, I have a letter that I've written. What I've asked to do is to go to universal Medicare. And the way I've started that is to start small, or maybe not as small, but where this time they start from birth till 28 is covered by Medicare. If a female is pregnant, she's covered from the time she's determined to be pregnant, positive pregnancy test, until 1 year after birth, to ensure that everything's taken care of. The other part, I have started saying that either 50 to 55, starting there, should be covered from then on. And then I would say in about 4 more years, you shrink it down to say 38 and 45, 40, 45, until you finally close that gap and you have raised the Medicare, Medicaid insurance, FICA insurance enough to cover that need, thus having instead of having multiple people giving you health insurance, you have one place giving you health insurance, which is Medicare, and they can work as a conglomerate with a bigger force of people that they're going to purchase with instead of these individuals. So you would get better insurance overall, and work with the hospitals and the prescriptions to come up with a better option. Thank you for your time, and please contact your representatives. Thank you for your time. Like, share, follow. I will be doing more podcasts as I can. Hopefully I can get them up more regularly. And please be sure to remember you are loved and there's nothing you can do about it. Thank you very much. Good night.